emergency medical technicians. They are experts trained to respond quickly to emergency situations regarding medical issues, traumatic injuries, and accident scenes. They are essential in providing pre-hospital care to persons who are ill or injured and would transport them via an ambulance to the nearest health facility for further medical attention. That essential service is provided 24/7 all year round by the Belize Emergency Response Team, BERT.
What we're doing today are our annual workshops to renew license to practice this medicine, this level of medicine in the field, because this is serious business. We didn't have anybody even understanding just over a decade ago what an EMT was, what being a paramedic was in this country. And our focus has been on training. We need to have good ambulance, we need to have the supplies and equipment to care for the patients, but more importantly, we need to have people who have been properly trained and is equipped and they are equipped with the knowledge and skills necessary to utilize those equipment and supplies and to understand how to assess a patient's situation and to apply the needed assistance to get that patient the best possible outcome from their situation, whether it be medical or trauma, and that's our focus.
To date, BERT is operating approximately 7 ambulances in the Belize and Cayo districts, providing emergency services, accompaniment service to cruise ship, for sporting and other events, as well as transfer services. There are over 400 persons in the country who have passed through trainings at BERT, but annually licenses as EMTs must be renewed. Since Monday, training and the licensing process began at BERT headquarters on Sunrise Avenue in Belize City.
It's important to make sure that all the EMTs are always performing at a high level of performance, both cognitively thinking, critically thinking, and also performing the skills necessary to save lives. And so it's important every year they renew their license so that we can ensure that they are performing and they are taking care of people to the very best. One of the things we're assessing today in the background here is we're assessing the ability to do a patient assessment, which is to be able to identify any immediate life threats that they need to stabilize to save a patient's life, then look for any other injuries that can be managed and stabilized prior to transport.
EMS evaluator Matthew Newell says that best practices change globally every year, and the training and licensing process allows for EMTs to get up to date with these new techniques.
People understand the importance of the pre-hospital setting and what we can really do to improve patient outcomes. And so we're refreshing all the skills that allow these EMTs to be able to make sure that a patient is stabilized and kept alive before they get to the hospital. Historically in Belize, you've gone to the hospital in the back of someone's pickup truck, okay? And that can do more damage, that can cause more injury than would otherwise have to happen. We also have issues of airway management. If someone's not breathing well, you only have 4 to 6 minutes before your brain starts to die. These EMTs are trained to manage airways, to be able to support someone's breathing, to be able to control bleeding. All these life-threatening things that otherwise aren't going to happen in the back of a pickup truck with a good Samaritan taking you to the hospital.
BERT has been providing the essential training since its inception and provides the best pre-hospital care in the country.
Well, I think you should be pretty proud of these folks. They represent the very, very best providers that this country has to offer, and I'm so impressed when I come here to provide training opportunities for them, because they're very motivated. They care so much about their fellow citizens and trying to take very good care of them. So right now, evaluations are doing very, very well.
This thrills me, because it doesn't matter where a medic works. If they're working in the Belmopan ambulance, if they're working at the hospital somewhere, in some of the cases, there are people who practice with us originally, but they're now working at the hospital in a different sector, but they're keeping up their license to practice. We're so proud of them. We thank them because we are contributing to our society by this.
There are several persons practicing as EMTs in this country who have not renewed their licenses. This, BERT says, is not a good practice. Dwayne Moody for News 5.